Thanks for everyone to be here this morning. And as Kate has said, this conference is jointly organized by the Academy of Medicine and Public Health Association in Delaware, as well as the Mid-Atlantic Alliance for Climate and Health. I'm a co-founder of that latter organization. And as Kate mentioned, we're sponsored going forward in the meeting by Energize Delaware and Delaware Humanities. Climate change and poor air quality go hand in hand and are with us right now. As a society, we need to take actions to both mitigate or prevent further harms and to adapt to find ways to live better with what is already occurring. Even if we stop burning fossil fuels right now today, the methane we put in the air yesterday will stay with us for the next 8 to 10 years. The carbon dioxide will stay with us for the next 50 to 80 years. We will continue to have warming temperatures. We will continue to have rising sea levels. So it's imperative for us to know how to live with those conditions. And it's imperative for us to stop the processes which are impactful on our health. The changes are particularly relevant to human health. The earth will survive without us. It's other living things, us and other living things, who will suffer. Making our air cleaner means fewer respiratory, heart, and multiple other diseases almost immediately. Let me say that again. So there was a question in the chat, what can I as a medical student do? Well, one thing we can do is to change our individual and communal carbon footprints right now, because we will have cleaner air right now, and that will have a significant impact. It also means if we change our footprint now, there'll be fewer greenhouse gases in the atmosphere and less risks further on down the line. So our sessions today are meant to inform, but also more importantly, to encourage us to work together for the hard work ahead. This panel, the first panel, is about healthcare specifically, and we've asked the panelists to talk about what healthcare and their institutions or their organizations can do and are planning to do internally to their organizations, and how they are working or plan to work within their communities to partner on climate and health issues. This panel is scheduled until 9:45, about 10 minutes per speaker. We will hopefully have a couple of minutes for questions. Please put your questions in the chat. There'll be a 5-minute break after this session, and then 9:50 we'll have our keynote address for the morning. The second session panel this morning will be on environmental justice as it pertains to healthcare, and hopefully many of you can stay on for that. So once again, let's get started.
I'm going to talk about healthcare practices, and I'm going to give you specific help in making climate change a core value of your practice. This is going to be a very practical talk. After my talk, we'll hear a lot about hospitals, but I want you to get energized and to really take action in your office. See if I can get my slides to move. There we go. Just briefly about me, I'm a gastroenterologist in Jacksonville, Florida, a past assistant professor at UC San Francisco. I do a lot of community talks and CME lectures on climate change and health. I help health professional societies to adopt climate change policies, about 24 of them to date. So if your organization isn't on board with really strong sustainability and climate change policies, call me. I'll give you some language. I chaired the Environment and Health section for Florida Medical Association for a decade, and was a member of the Florida Energy Commission, where we wrote legislation for Florida on climate change. And I'm speaking today as executive director of the My Green Doctor Foundation, and I have no financial disclosures. Just briefly about our foundation, we're a 501c3. We provide environmental sustainability services to healthcare practices, all free, as well as teaching materials on climate change and health for patients, brochures, posters, handouts, PowerPoints, and lots more. And through our work, we have access to thousands of waiting rooms around the world. We have 2 websites now, mygreendoctor.org, which is free, and mygreendoctor.es in Espanol for our Spanish preferring health professionals. I'm going to talk for this next 10 minutes about a couple of things. Why our outpatient healthcare practices are important from a climate change standpoint. What are the resources for greening our practices? I'm going to focus on My Green Doctor for about 5 minutes, and then we're going to get you started. This is what it's really all about. This is my town, Jacksonville, Florida, following just a level 1 Hurricane Irma in September 2017, the terrible devastation to tens of thousands of people who lost their homes, the economic, health, and emotional devastation, as you see here. This is a slide I put together from work by Jody Sherman and her colleague, Matt Eckelman from PLOS One in 2016. They looked at energy use across the healthcare sector and found that somewhere between 5 and 10% of U.S. greenhouse gases are due to healthcare. And I looked at this to break it down between hospital care, outpatient care, and other services to point out that about 26% of outpatient care, the work we do in our clinics, in our private practices, and our offices, about 26% of healthcare's greenhouse gases are due to our clinic work. And that means perhaps 2 to 3% of America's greenhouse gases are directly tied to what we do in our offices. So our offices really do matter, and we can make a difference by rolling up our sleeves and getting to work there. The climate impacts from our practices are important. There are millions of medical practices worldwide. Our offices can cause illness. As the EPA has told us, the air inside is often dirtier than the air outside from chemicals, particulates, fungi, and other agents. We use significant resources, as Jody Sherman told us: electricity, water, paper, chemicals, and foods. We're often high cost and highly inefficient. And as I said, our offices are responsible for about 10% of the U.S. healthcare sector's greenhouse gases. And finally, we are potent role models, as both Liz and Jody told us. This is an example of that. This is a slide from the Gallup survey in 2017, but it's done in many countries, many times, showing that among the most trusted professions, nurses are at the top and medical doctors and pharmacists closely behind. So what we do, what we show our patients that we're doing, and what we say to them really does matter. What are the benefits to your practice of going green? Well, you'll certainly save money by lowering overhead costs. The work that we've done shows that we can save a practice about $1,500 per doctor per year, year after year, through decrease in the use of energy, water, chemicals, and other resources. Going green has other benefits for the office. It improves office teamwork and staff morale. I've been to many, many, many green team meetings, and it's just wonderful to see the people's faces light up as they work to make their office healthier and their community healthier. It provides a better office experience for patients. I believe Green Office has an improved public relations profile and can improve patient trust in their health professional. We can create a healthier office. We can encourage wise choices by our patients and by their families. And the bottom line is, I think we can improve community health, both for the work we do in our office and how we talk to our patients and to families. So there are some resources for doing this. My Green Doctor is available online at mygreendoctor.org and .es. I'm a huge fan of the Royal College of General Practitioners Green Impact for Health program. The ACP, the American College of Physicians, has a very nice climate change toolkit for physicians that you can download, including materials you can give to patients. The British Medical Association has some nice guidelines, and I'm a big fan of the Pediatric Environmental Health Toolkit, particularly focusing on toxins that can reach the newborn babies. So what is My Green Doctor? This is an online environmental sustainability practice management tool. It's available in English at .org and in Spanish at .es. It's used by thousands of health professionals now in 44 states and 80 countries. 26 organizations provide My Green Doctor to their members as a free membership benefit, and I'd welcome offering it to your organization to share with your members as a free benefit. We offer it to your organization and to your members without any charge. My Green Doctor is comprehensive, science-based, written by health professionals, and non-political. It's for any type of outpatient healthcare office or facility or imaging center. It's easy to use. It's fully scripted. So if you ask your office manager to use My Green Doctor, she or he really has nothing to study or prepare. They don't need to become a tree hugger or a sustainability expert. They just need to read the script. And most offices save money in the first month using our program. These are 26 participating organizations that provide My Green Doctor to their members as a membership benefit. Big organizations like the World Medical Association and the American Academy of Family Physicians, and then many smaller organizations as well. I'm delighted to announce that both the Medical Society of New Jersey and the Medical Society of Delaware became participating organizations earlier this year. So welcome, New Jersey, and welcome to Delaware. These are the 6 steps towards making climate change a core value and letting your office benefit from going green. It's very simple. You register at My Green Doctor. If you're a member of the Medical Society of Delaware or the Medical Society of New Jersey, you have a unique discount code that makes the service totally free, saving you $60 a year forever, and many, many other benefits. Each of our participating societies has a unique discount code. Adopt sustainability as a core value. Speak to the management of your practice. Make this a core value as important as compassionate care for your patients, HIPAA compliance, treating all of your colleagues with respect. Environmental sustainability needs to be one of those core values. And then brag about it. We're going to send you, when you register, a lovely certificate you can put on your wall to tell your patients and your colleagues, hey, we're going green. And then plan to add 5 minutes of My Green Doctor to each practice organizational meeting, whether your practice meets once a month to talk about business issues, or maybe you have a weekly or daily huddle. Just add 5 minutes of My Green Doctor, and I'll tell you how to do that in a few minutes. Plan to make small, steady improvements in your organization. Keep going, keep going, keep going. We have more than 140 things you can do in your practice. Do one each meeting and make those steady changes. Educate your patients by providing your patients with brochures, posters, and other teaching tips, and commit to qualifying for the handsome Green Doctor Office certificate that will come from your participating society, professional society, for free. We have my meeting guide for adding 5 minutes of My Green Doctor each practice planning meeting. Each session is fully scripted, so there's nothing to plan or prepare. We tell you exactly what to say and do at each meeting. We focus on slow, steady improvements, that you have a sustainability program. We emphasize patient and staff teaching. We encourage discussion and staff involvement, and we provide a Green Team Notes form for easy record keeping so that you can earn that Green Doctor Office certificate in just a couple of months. There are many, many projects that we suggest, but they include assessing your carbon footprint, using Energy Star appliances, choosing safer chemicals, recycling, avoiding styrofoam and other unnecessary products, healthy eating in the office and at home. We have lots of educational tools. I show a poster up top, and we have a pledge certificate that you get to put on your wall when you register to say to your patients, hey, we're going green, we're doing something important for you and for our community. And I mentioned patient and professional education. We offer dozens of waiting room brochures that we created, and others from other organizations, in English and Spanish. Climate change, a particular focus. We have posters, a tip of the month program for communicating with your patients, many blog essays and topics. We have an environmental sustainability policy for management. If you're a big organization and need to implement sustainability into the structure of your policies and procedures, we have a management program policy there for you. We have a quality improvement curriculum for medical students and public health students, and we have free educational courses for professionals. This is something I'm very proud of. These are our new Your Healthy Home brochures, and they're really terrific, I think. And we're actually studying them for the first time in clinical settings around the country. We have an IRB-approved study. If you would like your primary care practice to participate in the study and to distribute these brochures to your patients, contact me and we'll try to get you in the study and give you free brochures and let your patients tell us what do they think of this. This is the Green Doctor Office Recognition certificate you receive when you complete our program. Very handsome, put on your walls. My last couple of slides, I want to show you some success stories. This is the Escambia County Health Department that used our program. They have 5 offices in the Florida Panhandle. They saved energy every month, including reducing their electricity by about 5%, 125,000 kilowatt hours of electricity saved, 85,000 metric tons of carbon dioxide averted per year, saving about $14,000 a year. They've done creative things with the money, including this year, 2 years ago, putting solar panels on one of their buildings with the money that they saved. Okay, I want to remind you how to get started, how to make climate change a core value of your practice. Register at My Green Doctor. Remember those discount codes for New Jersey, MSG, My Green Doctor, MS New Jersey, or MSG, My Green Doctor, MSD, excuse me, for Delaware, Medical Society of Delaware. Talk to your management, adopt sustainability as a core value, and brag about it by putting up your pledge certificate on your walls. Plan to add 5 minutes of My Green Doctor to the agenda of every practice meeting. It needs to be there, just 5 minutes for the environment and the climate. Plan to make small, steady improvements and to keep going. Provide your patients with brochures, posters, and other teaching tools, and commit to qualifying for the Green Doctor Office certificate. I'm almost done. I want to thank our coordinating committee, David Donahue, Alan Greenglass, Pat Panzer, Anna Kiesel, Debbie Zarek, and particularly Kate Smith, who held us all together, the Medical Society of Delaware, Delaware Humanities, and Energize Delaware. And I want to thank you for going green. And I'll stop there.
Thank you, Todd. Take a look at Todd's email. I know he's very responsive if you have questions, as long as he's not in Africa. I know I got kicked out of the meeting while Todd was speaking. I'm not sure if that happened to other people, but fortunately could get back in. Next panelist is Dr. Hugh Bonner. Hugh is a practicing family physician as well as the Associate Program Director for Family Medicine on the faculty of St. Francis Hospital in Wilmington. He's particularly interested in population health and the role of climate change as a social determinant of health. Hugh is an active member of the Mid-Atlantic Alliance for Climate and Health. So Hugh, are you there? Yeah, say yes, please.
Dr. Bonner is there. He's on mute.
Okay.
Okay, I was able to unmute myself. Thank you.
No problem.
Now, I have slides. I don't know. I
Nope.
sent
Give me 1 second.
version 3 of those is most updated. Let's see. Hopefully this will be version 3. Otherwise, I'll be okay either way. So this talk was put together by myself and Kathy Cardillo, MBA, and Dr. Stephanie Malleus, who's, I think they're both on the call now. So the three of us put these together. Kathy is in our administration, and so she was very helpful in getting much of the information needed for this talk. And Stephanie has been very involved in the MAACH as well. Next slide, can I advance that? So this slide, I have just a couple basic science slides. This may be really basic for people, but for me, they've always been important in this topic around climate change. This is atmospheric CO2 over time. And if you can look at the year you were born, like I was born in 1964, and the atmospheric CO2 was just about 320, and now it's just past 420. The atmospheric CO2 was roughly 280 for the last 10,000 years, and then slowly started creeping up in the late 1800s with the beginning of the Industrial Revolution. And so most of the increase is really over the course of our lifetimes. So a huge increase. There are many other gases that contribute to atmospheric climate change. Methane was mentioned. The anesthetic gases I learned about in preparation for this have a role as well. And next slide. So this is just sort of a drill down on the exact same data over a shorter period of time. And you see that it has spikes up and down. And some of you may know what that is due to, but it's actually because there's much more land mass in the northern hemisphere of the planet. There's a greening of the northern hemisphere every spring into the summer. And all that greening takes in CO2. So the whole planet, in essence, is breathing. And I'll just mention, I first heard of CO2 in a climate lecture when I was in, I think, 10th grade. And what I remember about it is I couldn't understand at all. The speaker spoke for about an hour on this topic, and I never really understood what he was talking about. But for some reason, I always remembered that lecture that I didn't understand. So it was about this topic. So this has been known about, in the late 1800s, people were already realizing that CO2 was a greenhouse gas, and there are references to go back that long. So it's really always, it's been known for over 100 years. Next slide. Now this slide, the next 2 or 3 slides, is the last bit on a little bit of science, but I got this idea from Dr. Neil deGrasse Tyson, who one of his many educational shows that I happen to be watching, it showed how thin the atmosphere of the Earth is compared to the Earth itself. And it really struck me. And the reason I added this to the talk is just because we think of there being a large area into which we release all our greenhouse gases, but it's smaller than we think. So the atmosphere drops off very rapidly. So Everest is at 9,000 meters, and there's only about a quarter of the atmosphere there, which is why it's so dangerous for climbers. And jet airliners go just a bit above that. And the edge of space is defined as about 60 miles. Next slide. So if you do really a Riemann sum, but I just did this in the addendum, but if you look, if the atmosphere never dropped off and then suddenly dropped off instead of going down asymptotically, how thick would the atmosphere be? Well, if it stayed the thickness at sea level and then suddenly stopped, it would only be about 5 miles or 8 kilometers to the edge. And the Earth is almost 8,000 miles or approaching 13,000 kilometers. So the skin with the atmosphere is incredibly thin. Like, it's not like an orange. It's not even like an apple peel. It's much thinner than that. So I think that's why we can have such a massive impact on our climate. Next slide. So that's just the idea that it's not that big a volume that we're putting all of our industrial waste into. So the next slide is, these next slides are from Kathy Cardillo. So I'm ready for the next one. And this is about Trinity. So we heard so much information in our first hour this morning about healthcare systems, and a lot of that was new information to me, and it helped me to fit some of these slides in. So you see Trinity is about a 20.2 billion industry in total, and the green are the states it's in. So it's 88 hospitals. I work in the St. Francis Hospital here in Wilmington, Delaware. We're part of the Mid-Atlantic group of 4 hospitals. So there's a possibility for a large impact. Next slide. So the core values, in looking at these core values of the Trinity Health and comparing them to climate change, there is a lot of overlap. Issues around stewardship of resources, commitment to those who are poor. Next slide, please. And this is the pillars. And looking at these, many of these pillars have strong overlaps with climate change and the health of the planet. Public health investment certainly does. Improving maternal health access, housing access, food access, racial equity. All these are tightly interconnected with climate. Going to the green, immigrant access, there's massive waves of immigration, never been higher than it is currently, due to climate change in large part, affecting harvests, affecting the health of populations, making them have to make changes. And then the purple, and I have everybody's face over top now, so I can't see it as well. Let me see if I can, there we go. Social care, innovation, protecting Medicaid, all these issues connect with climate change. So the next slide. So the hospital system has been partnering with national coalitions, has been involved in contributing to supportive regulation that is helpful around the climate and around public health. I've seen that in blurbs that I've seen over the years, particularly through the pandemic, where there's been a focus on global health and health of the public. Next slide, please. So, and the Catholic Church, which has which is a group that we are connected with, of course, has focused significantly on the health of the climate. Pope Francis has had focus on that. And there was a statement from the U.S. Conference of Catholic Bishops in line to try to reduce greenhouse gases by 50% from the 2005 level till 2030. So in the last few slides, you see that there is a broad consensus and support for ideas that we're talking about today. And this slide also supports that. And there's 2 Catholic organizations that are particularly involved in this area, including the Catholic Climate Covenant. Next slide, please. So that's the system as a whole. And so I think there's a broad-based alignment and consensus with what we're trying to achieve. Now, I am a practicing family doc, so I'm not high up in the administration, so I don't go to so many meetings where this may come up on a regular basis, but I think the support is there. Things we might do at St. Francis, these are basic things. Probably some of these would be in my green doctor, shutting down computers at night, LED bulbs, looking at disposables, which was really mentioned a great deal in the first lecture today. Anesthetic gases were mentioned, and they have significant greenhouse effects. So looking at that, and we saw an earlier slide today on types of anesthesia that might, choices there that might lower the use of gases. And there's a great deal of interest. I've seen it in our residents in the last 5 or 10 years around green diet, around a vegetarian diet, plant-based. And so I think I'm really seeing that come from the bottom up. And we have a tiny step program where we provide locally grown food to people locally who are in need. And so I see those food containers come in on a weekly basis. Next slide, please. So energy use, I think myself and the 3 of us working this would try to work and encourage our hospital, if we're not already, to look for renewable energy sources. We still have gas vehicles here, but we have 2 or 3 vehicles that I see. Then we have the ambulance service. So those are areas where over the next few years, I think that the movement towards electrification would have clear climate benefits. Next slide, please. So other things too, and Dr. Malley noted that we will open our doors toward people if it's cold, like on cold winter nights, but how that might become important with heat, the heat index getting so high on some days. We might need to do a similar thing with the hospital on days where the heat is extreme. So using that model. Also in Wilmington, we have a lot of areas that are low sea level. We have a couple rivers close by where there's lots of flooding potentially. So, and these are the patients that we see regularly. So there's a lot we can do to try to address very local areas that are going to be impacted by climate change. Next slide, please. So many things, and when I read the news every day, really, I'm seeing people all over the world. The ones that struck me recently is problems with the harvest in China due to the heat wave, and also in the US, and also I believe in Europe. So all sorts of problems around climate that we're seeing that we all need to act on, and we all know that if we're here today, and we heard that in the first hour. So my last question is, what are we going to do? And I know that's what today is about. So, and that's it. So thank you. And I'll end there.
Thank you. I know that we're running 5 to 7 minutes late. I know that Dr. Sergio's keynote is going to be a little shorter than an hour, so we'll try to keep all our speakers to their 10 minutes going forward. One reason we're together today is to share information and to hear about ways we can work together on these issues. So, you and folks at St. Francis, think about what Todd talked about as a resource for your practices. Our next panelist is Bettina Riveros. Bettina is an attorney who serves multiple roles at Christiana Care, including Chief Health Equity Officer and Senior Vice President for Governmental Affairs and Community Engagement. Prior to joining Christiana Care, she was Senior Advisor for Health Policy to Delaware Governor Jack Markell. And Bettina, your turn.
Thanks so much, Alan. Really terrific to be here. I'm honored to participate in the Climate and Health Conference. I'm Bettina Riveros. As Alan said, I lead health equity and government and community engagement here at Christiana Care. If you could go to the next slide, please, Kate. And I'm going to really zoom out a little bit from what we've heard, like amazing speakers in this session and earlier today, really focusing on us as an organization, as a leading health system here in Delaware and the surrounding region. Our mission is to care for our community, to serve our neighbors as expert caring partners in their health, and providing innovative, effective, affordable, and equitable systems of care. We're very focused on health equity. I've been Chief Health Equity Officer here since early of 2016, really focused on all issues driving inequities and disparities in health and health outcomes. That can range from violence intervention initiatives to food and housing and transportation, and adding community health workers and a whole suite of those services. As we look at this issue around how we prioritize environmental health, I really want to echo Elizabeth Finkelman, who said climate crisis is a public health and equity crisis. We are increasingly aware, we understand the connections between the environment, climate change, and health. No surprise to anyone. And we at ChristianaCare are really prioritizing environmental health. As the state's largest employer with over 13,000, close to 14,000 employees, we recognize that we have an obligation to be environmentally responsible, to be a leader, to reduce greenhouse gas emissions, and really lead in our community and, frankly, across the region and beyond as far as a healthcare leader in sustainability efforts. If you could go to the next slide, please. We've heard from other speakers on the impact of climate change on health. As I've said, we in addressing in our commitment, we heard a lot from Dr. Jody Sherman and others. We broadly categorize the impact on health as acute or chronic risk. You've heard this from other speakers today, everything from extreme heat to air pollution to impact on cardiovascular and respiratory mortality. All these things negatively impact health equity. One of our core strategic imperatives, frankly, at ChristianaCare is to end disparities, and that aspiration is part of our strategic plan. This work coincides and aligns with our work on health equity. As we saw in September of 2021 in the Riverside community and 11th Street Bridge community, we had massive community flooding, and we know that disadvantaged communities bear the brunt of climate-induced risks. We know the zip code matters. Here in Delaware, we've got significant discrepancies. Depending on where you measure, it could be 13 years lost in life expectancy or 16 or 18 years from one part of our city to a couple miles away. That is not acceptable, and it's exacerbated by environmental risks to public health. Could you go to the next slide, please, Kate? Thank you. We've heard a lot today about this, recognizing the healthcare sector is a major contributor to climate change. I think it's really important for us as a large healthcare organization to acknowledge this, frankly. We know that the healthcare sector accounts for close to 8% of national carbon emissions. We have a large operational footprint. That impact includes, anesthetic gases, natural gas supply chain. We heard a lot about supply chain from other speakers. We know that we can reduce our carbon footprint through the way we purchase products, through ways to reduce waste, using energy in our buildings. We know that climate change is a huge global threat, and we have the opportunity now, and we've heard this throughout this morning, really the opportunity. Climate change is an environmental public health threat, and frankly, an opportunity right now to change the trajectory and improve the health of our community. And we need to seize that opportunity. Could you go to the next slide, please, Kate? At ChristianaCare, we're taking action now. We heard from Elizabeth Finkelman. She talked about the barriers and getting C-suite commitment. I have to say, I am a member of that C-suite along with our Chief Financial Officer, Rob McMurray, are co-charged with leading our effort on this front. And that is a firm, high-level strategic imperative. So how are we acting? Right now, we are measuring our scope 1 and 2 carbon footprint. For the first time ever, we're really working to identify standards and metrics for reporting. That has been significant work, and we are undertaking that work so that we know, frankly, our baseline. What is that footprint? We plan to set a carbon reduction goal aligned, once we understand that footprint and based on science and other standards. We're developing a roadmap around and governance structure to a roadmap to achieve our goals and monitor progress along the way, and critically establishing that governance structure to manage our progress and against environmental goals, and really engage our employees, which we call caregivers, engaging caregivers in sustainability initiatives. We have a comprehensive framework called our ESG, or Environmental, Social, and Governance Framework. That is, I believe, I believe it was it Liz or Kate perhaps, who mentioned ESG. But we've established that governance framework for this work. We'll be launching this fall that framework, and the caregiver or employee environmental sustainability committee, along with other groups, to do that work to really understand how we can drive sustainability initiatives. That governance model will reflect our commitment both to health equity and environmental stewardship. So we've been engaged in the past year in that strategic planning to develop that framework. That's going to drive how we can address our environmental impact, and that, as well as that commitment to health equity. We've heard a lot about that. Obviously, there's the Office of Climate, Health, and Equity. They go hand in glove. We all, I believe, understand the important, that essential link. So we'll be embedding both equity and environmental goals across our business, including buying practices, including facilities management, and frankly, including health advocacy. We have been a strong advocate for key initiatives and social drivers of poor health, everything from supporting locally the maternal and family leave act here in Delaware, initiatives around gun violence, initiatives we've led in implementing higher minimum wages here in Delaware. We lean in on advocacy fronts that support improved public health and the improved health of our community. And we expect we'll be doing the same and looking for opportunities around advocacy as well. And I believe that's my last slide, Kate. Here is my contact information. I am trying to get us back on track a little bit, but really excited about this work. As I said, Rob McMurray and I are partnering around it, and we know that we have terrific assets. I know I saw Greg O'Neill on here, caregivers who are so committed to these issues, who will be essential leaders in this work going forward. So super excited to share what we're doing as a large healthcare organization here in Delaware and the surrounding region, including Maryland and Pennsylvania and into New Jersey. Thank you so much.
Thank you, Bettina. Thanks for speeding through there. So a couple things before we introduce our last panelist for this session. One is, as Bettina said, we have a public health crisis with climate change. The American Medical Association passed the resolution this past June calling climate change a public health crisis in the United States. Our friends at the Medical Society of Delaware were part of that session and supported that. So thank you for that. So that's one thing to realize. Another thing is, I hope, and I hope it's not a strategy, but I hope that everybody on this session, including the various health systems and certainly Todd and the people coming up in the second panel, are agreeable and open to sharing your successes and progress with each other. This is a big issue. The air we breathe isn't just over St. Francis Hospital or Christiana Hospital. It's everybody's problem. an opportunity. And if somebody's doing something great, such as Todd or we're going to hear from Abby from the Moores, to be able to share that with others to jumpstart their work. I see that, I know Jim Fletcher is on our second panel. Jim is on the staff at Bay Health. That the more we can do and share, the faster this work will go, the easier the work will go. Just one more factoid before I introduce Abby, and that is, the air we breathe, and I said this earlier, is a health hazard right now. It's estimated that about 18% of the deaths from COVID in the United States were related to PM 2.5, particulate matter, that which is the result of burning fossil fuels, mostly coal, in our atmosphere. And Delaware still gets 20 to 30% of its electricity from coal. So we have an opportunity right here at home to make changes that will clean our air, decrease the risk of health hazards. So Abby Nerlinger is a pediatric hospitalist at Nemours Children's Hospital and an assistant professor at the Kimmel Medical School of Thomas Jefferson University. She's the medical director for community engagement at Nemours. As though she wasn't busy enough, Abby also has a master's of public health and sits on the executive committee of the American Academy of Pediatrics Council on environmental health. And her research currently focuses on health system and community relationships, partnerships. I know that some of that research work is in partnership with folks at Christiana. So that's an example of sharing your energies and knowledge to make progress faster. So Abby, I think, as I said, I think you have 10 minutes, and then we'll do our short break right after that.
Great, thanks, Alan. So I'm going to talk a little bit about at Nemours, both where we are and where we're going. So we know that climate change caused by greenhouse gas emissions from both healthcare and non-healthcare sources is not only impacting the health of communities, but also importantly from a mission standpoint as well, that it's really relevant to the bottom line with the transition to more value-based contracts. So climate change is affecting acute care utilization, it's driving health disparities, it's driving how we think about population health management within health systems, and impacting chronic disease control. So I thought I'd just take one slide to point out the particular vulnerabilities of children in the face of climate change. So we know that children are not just small adults. They breathe more air, they eat more food per pound of body weight than adults, and they go through particular developmental stages that can impact their vulnerability to environmental toxins. So things like hand-mouth behaviors, and then also susceptibility during very sensitive times of development. If anyone's interested in learning more, the AAP does have a policy statement from 2015, Global Climate Change in Children's Health, that's currently undergoing revision and will be released soon. To give an overview of activities currently going on at Nemours, I'm going to frame this in terms of our transition to value-based care, climate change as a social determinant of health, joining the Healthcare Anchor Network, which I know Christiana is a part of as well. And then our Nemours Environmental Sustainability Work Group, and also thinking about the role of our National Office of Policy and Prevention. Thinking about how this needs to be very mission driven, I wanted to highlight Nemours' pillar dedicated to health, value, and equity, because this is a theme that we've heard other speakers discuss, that thinking about climate change really aligns with this pillar to improve community health, how we think about value in healthcare systems, and also how we aim to address and improve health equity. So Nemours Value-Based Services Organization is sort of the branch within Nemours that's helping us align with high value care and make the transition to more value-based contracts where we're taking care of and responsible for risks for populations of patients. In alignment with this, we're really rethinking how we dedicate resources to whole child health and communities and populations. One component of this is a large expansion of our data analytics and technology capacity. So, within Epic Healthy Planet, how we're doing risk predictive modeling, how we're doing clinical risk scoring, and are there opportunities here to look at how we can think about healthcare utilization in the setting of climate change. So, for example, looking at utilization surrounding extreme weather events like flooding, there have been increasing studies coming out in pediatrics showing this connection between acute care utilization and extreme weather events. Can we integrate secondary data sources like the Child Opportunity Index into some of our healthcare data to see how environmental factors are impacting healthcare outcomes so that we can better understand where to target community resources, which is something I'll talk a little bit more about. Uniquely to Nemours, we have our Delaware Children's Health Network, which is a clinically integrated network that integrates 13 non-Nemours primary care practices into some of our risk-based contracts. So are there opportunities here to sort of scale and spread interventions like My Green Doctor and resources through Practice Green Health? In terms of things that we're already doing, really the implementation of evidence-based clinical pathways that reduce variations of care, reduce healthcare waste, and allow us to provide high-value care also reduce our carbon footprint. So we think about applying choosing wisely criteria for pediatrics, like ordering less chest x-rays for children with bronchiolitis. That is also reducing carbon footprint. So is there a way that we can track metrics like that as we're tracking our quality data? And then next is really thinking about population health management. So we have an enterprise-wide social determinant screener that we're scaling across all Nemours practices, both in Delaware and Florida. We do have some questions on our social determinant screener related to housing. There is more data coming out and more advice nationally, especially from the AAP, in terms of how to integrate climate questions into this and how to counsel families when they have concerns about climate change. And I think particularly important to this is when we have data from a social determinant screener, how can we think about the disproportionate impact that climate change may have on families who are reporting positive social determinant screens in other areas like food insecurity, housing insecurity, and concern for utilities. So for example, we know that families already impacted by food insecurity might be worsened and might be more impacted by supply chain issues. Flooding and contamination of municipal water supplies and boil water advisories may be even more difficult for those already at risk of unsafe drinking water. And trouble paying utility bills reported on the social determinant screener can also be impacted by extreme weather events. So thinking about how some of these climate change and social determinants can negatively synergize to impact health disparities. So lastly, I'll just talk about our operations as sustainability. Nemours is part of the Healthcare Anchor Network. The goal of this network is to really align hospital operations with the community and to develop sustainable economies. Healthcare Anchor Network is currently developing environmental sustainability guidance in partnership with Practice Green Health. And in response to that, Nemours has a work group on environmental sustainability that is attempting to provide sort of a data-driven baseline energy audit. So an energy audit we will upload energy data to the Healthcare Anchor Network so we can compare this to metrics from other healthcare institutions to really understand where we're fitting into that to drive a data-driven sustainability plan in the future. And then we have our National Office of Policy and Prevention and thinking about how we can engage this office in terms of advocating for federal policy guidance around climate change, both legislative and executive branch advocacy. So just to summarize future directions, I think goals to address climate change, improve climate justice, and thinking about environmental sustainability include using data to inform our community partnerships and care delivery, targeting resources to help mitigate the effects of climate change for those we know are most vulnerable. I've highlighted briefly a map that I made with a tool through the EPA called EJ Screen that shows medically underserved areas in Wilmington in yellow and how they overlay with areas of coastal flood hazards in red. So we know that these populations that are already susceptible to climate change can be even more impacted in the course of extreme weather events. And this was highlighted during Hurricane Ida in 2021. This is an article from Delaware Public Media that shows an area of flooding in downtown Wilmington that has some of the lowest median household income in the city in Newcastle County, and also some of the highest rates of health disparities. So how can we work with communities to really drive change in these areas through our partnerships? Nemours can make attempts to centralize its efforts and develop a formalized energy strategy, which it's working on now through collaboration with the Healthcare Anchor Network and this baseline energy audit. We can focus on provider and trainee education, thinking about how this can be both a top-down mission-driven approach and a bottom-up approach through provider and trainee education. We can also involve our clinically integrated network and realize that overall proactive steps towards environmental sustainability can help improve health outcomes, well-being, and equity for the patients and communities that we serve.